The study was designed to determine whether or not the standard of care at that time, meaning lumpectomy plus whole breast irradiation delivered in 6 to 7 weeks, could be reduced down to 1 week or less by performing what's referred to as partial breast irradiation. In other words, improving the quality of life of patients by reducing the number of treatments of radiation and even the intensity of that treatment as well. We randomized 4,216 women, and what we found was that we didn't demonstrate equivalence, but we found the difference between the two techniques of whole breast irradiation and partial breast irradiation was only 0.7% at 10 years. In other words, a very small difference, suggesting that for a large proportion of women, the shorter, less intense technique may be appropriate and just as efficacious as standard treatment. We tend to follow the guidelines that have been established by the radiation societies, in other words, offering this to certain selected patients, but I do offer it to my patients, and as you can imagine, the quality of life is dramatically improved. Instead of coming back and forth, in some cases for 33 treatments over 6.5 weeks, we now are down to 1 week or less, and they're definitely appreciative of this, knowing now that if there is a difference, it's very, very small. And there were no differences in survival, as noted from the study, suggesting that it's not risky by reducing the amount of treatments for patients. Yeah, we looked at the risk of second cancers, whether it was different between the arms, and it was not different. We looked at the toxicities, in other words, by decreasing the treatments down to a week or less. What's the offset? I mean, are we hurting our patients? And we didn't. We found the toxicities were low, and there were no significant differences between them. We are looking at some other issues of quality of life and cosmetic results, but we know from other studies that have been done already, that if there are differences, again, they're very small. And so we want to be able to offer to our patients an equivalent technique, right, done in a week or less. I mean, you know, as I mentioned earlier, the quality of life is such a dramatic difference in these patients. It's kind of intuitive, right? 33 down to 5 or less. It's nice to be able to offer that to our patients. You know, well, I think it just reinforces the physicians who are applying these techniques right now that it is safe, that it works, and reinforces to patients, reassures them that you're not compromising your care by making it, more, I hate to use the word, but more convenient, right? And it's whenever you talk to patients, they want the best treatment, of course, but certainly to be able to have the best treatment in a week or less is a nice advantage for women, and they don't have to feel like they're compromising any of their care by getting it done quicker.